Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Science and Public Policy at Walden University with the joint faculty appointment at Ross University School of Medicine. I've been talking a lot about Lyme disease in another audio/visual, and wanted to go deeper into understanding this in another sort of perspective. And so this was a systematic review. And so they screened a total of 923 articles, and then included 10 cost-effectiveness analyses and 11 cost analyses. So what they found in 6 studies assessed economic burden from a societal perspective. Economic impact, 735,000. And then in Scotland has a population of only 5.4 million and about 14 cents per capita. So notice that it's a fact that even after spending more money than other places, the actual consequences doesn't go away. So that is Lyme disease. Now, understanding Lyme disease in the United States, 130 per 100,000. Other countries do not quite have that amount. So the search strategy actually used Prisma. That's one that I'm familiar with, and some of my students use. And then data extracted from different places. So here's the descriptive analysis bubble chart displaying studies included in review by study year. And there we go. It's by study year. So let's go back to the actual study. And you can kind of see over here some of the cost, effective cost analysis. And let me. So just looking at this closely, study characteristics, North American countries versus European countries, tour. Number of strategies, so 2 or less, 3 or more, and that's how this is divided. Again, you always have the opportunity to look on your own time. So here are the outcomes. So cost, health, and cost effectiveness outcomes reported. So this is a bit more detailed here. So if we're looking at some of the costs that are here, the hospitalization for complications of antibiotic therapy, ambulatory visits, and treatment. So that's the cost. Health outcomes, it could be anaphylactic shock, minor and major complications, and also quality of life. Oral therapy with 100 milligrams of doxy, at home IV administration of ceftriaxone. So there's decision analysis, looking at different costs and no testing, no treatment. And so this expands to understanding vaccination costs. So there's all these different types of costs that were derived. And there are different types, so you can look for different varied number of outcomes. As far as some other parts of this article, so let's go back to the actual article. So you can just look through this, kind of scroll through this, and take a look now further and understand some of the policy level understanding cost effectiveness rather than focusing on just health outcomes. And again, outcomes reported, cost analyses focusing on overall healthcare costs. There's some indirect costs. And study findings, 3 diagnostic cost analyses were included in this review. Reported costs are standardized to 2017 USD currency, which its respective inflation. The first U.S. study by Strickland conducted that 30,000 tests were actually performed annually. Of course, there's limitations and then conclusions, and then they actually give you the search strategy, which is very interesting. I'm gonna give you a glance, quick look at this. So here you have the various Borrelia infections and some of these search strategies. I think you should go over these search strategies because they help in understanding how to derive some of this information from all of these articles. Take a look at these, and thank you for listening.